Gibson and Kohli for Snackable Health. Payal, talk to us about the changes in the CDC recommendations regarding maternal health and the stunning statistic that 4 out of 5 maternal deaths are preventable.
Yeah, Mike, this is really alarming. The CDC just published this data this morning, and it kind of knocked my socks off because I didn't expect to see it. And this is just to set the context of this really data, from before the COVID-19 pandemic and also before the overturning of Roe versus Wade, which we expect will have even more of an adverse effect on maternal morbidity and maternal mortality, including maternal death. So what we have seen is really an increase over the last several years in the number of moms that are dying either during pregnancy, during delivery, or right after delivery. And what we realize now after this data has come out is that the majority of those are actually preventable deaths. And if you parse out the data, it's really quite interesting and alarming to see that the number one cause overall of maternal pregnancy deaths was actually mental health conditions, with 1 in 5 deaths being a result of mental health conditions in pregnant women or new mothers. For Black women, it turns out was most commonly actually heart disease that led to their death. And then for Asian women, it tended to be hemorrhage. But the CDC has issued this data as a wake up call for all of us to really think about how we can plug some of these pregnant women into systems, into support systems, and connect them with resources that could help minimize some of this morbidity and mortality that we're seeing.
Yeah, Black women, Haitian women, some other ethnicities, they have a higher risk of dilated cardiomyopathy and could really benefit from some of our cardiovascular services, right?
Yes, absolutely. And the thing about, heart disease, as you and I well know during pregnancy, is that it's something that you can treat as long as the mom is kind of plugged into the right resources. So often what happens in some of these women, the Black women, even Hispanic women, is that lack of connection to healthcare resources allows their disease to sort of flare or go uncontrolled. And then you don't actually detect it until it's a little bit too late. The horse is out of the barn, and that can lead to adverse complications for mom, but baby, of course, as well.
So, for these at-risk populations, probably a little more aggressive, watchful screening and things like that.
I think screening, I think education is a big piece of it as well. And I think making sure that especially the mothers that are uninsured or don't have good access to healthcare are plugged into free clinics or other resources that may be able to help them sort of detect some of this. And what's interesting, if you look at the breakdown, not all of the deaths actually happened during the pregnancy. In fact, the majority of them, 53% of them, happened a week after birth. So even after the woman delivers, she continues to sort of be in this high risk phase, which we sometimes forget about. We sort of think, okay, mom's not pregnant anymore and things are better. So I think just understanding some of why we're seeing this, why we're seeing the overall deaths go up, how the Roe versus Wade decision might impact this as well, and then really trying to change systems to help some of these women so that we can reduce some of these numbers.
Stunning numbers. Thanks for the roadmap for success. Thanks to all of you for joining us here for Snackable Health.